In order to do a female straight cath, I would review my orders, I would obtain my supplies, I would then introduce myself, I would wash my hands, and then I would identify my patient in 2 ways. I would go through, I would assess the patient, explain the procedure, answer any questions. I would review their allergies, make sure they're not allergic to latex or shellfish. I would provide privacy, make sure I have adequate lighting. I would then raise the bed for proper body. So prep my patient, I would put the patient in a dorsal recumbent position. I would get assistance if needed. Then I would organize my work area. Then I would don my non-sterile gloves. I'd have already exposed just the peri area, making sure to cover everything else. And then I would get my stuff for peri-care. I would wrap my washcloth. I would go down each side and then down the middle, making sure to use a different side of my washcloth every time. Then I would remove my gloves appropriately, and I would wash my hands. So to do my procedure, I would open my cath kit. I'd carefully grab my sterile gloves. I would don my sterile gloves. I would then use this to lengthen my sterile field. I take one fenestrated drape, make sure to shine the side down. I'd use that to make a sterile field. I take my second fenestrated drape, shiny side down, and I would ask for assistance or have the patient help me, but place it under the patient, slightly under the patient's buttocks. I take my last fenestrated drape, make sure that the shiny side is also down, and place it just over the peri area. I would then take out my urine cup. I would sterilize the vagina, going down each side. Using a different swab each time. And then going straight down the middle with my last. I would then have my assistant grab the catheter, open it for me, and then I would lube the catheter 1 to 2 inches with my non-dominant hand. I would open the labia. I would instruct the patient to bear down. I would insert the cath 1 to 2 inches until I got urine, and then I would continue and insert another 1 to 2 after that. If the catheter didn't go in the urethra the first time it went to the vagina, I would start over and get a new cath kit. Once I have 20-30 cc's in my sterile specimen cup, I'd pinch it off, and then I would empty the rest of the urine into the container until urine has ceased. Once the urine has ceased, I would instruct the patient to relax, and then I would carefully and slowly remove the catheter. I would then close my specimen cup, label it. And then I would get a biohazard bag. And put my orders in the front and send it to the lab. I would then remove some of the drapes and the catheter. And discard them appropriately. I would measure and then discard the rest of the urine appropriately. I would then provide peri-care again after I remove my gloves, wash them, and then don non-sterile gloves. I would provide peri-care, making sure to change the side of the washcloth each time, dry the peri area. I would then finish removing the drapes, get assistance if I needed to, discard appropriately. I would then lower the bed, put the patient back in a position of comfort and safety. I would wash my hands again, and I would provide privacy and get her back to comfort. And then if she wanted her family back in, I would do that, and then I would go document how much the output was.